Today we're going to be covering the second portion of the digestive system. So we have viral infections, fungal infections, and we're also going to be touching on helminthic infections, so parasitic worms, towards the end. Alrighty. So, the viral diseases we're going to be discussing. So we're going to talk about mumps because it infects the parotid glands. These are salivary glands. And then we'll talk about viral causes of gastroenteritis. So rotavirus and norovirus are two big ones. There are actually quite a few other viruses that can also cause gastroenteritis, which is nausea and vomiting for a few days. But these are the two main ones that we're going to focus on. So this little table is a good compare and contrast. Again, for viral gastroenteritis, similar to what we saw for a lot of the bacterial gastroenteritis, the treatment is going to be oral rehydration. And mumps treatment is going to be preventative vaccine. It's part of the MMR vaccine, so it's covered under there. What differentiates rotavirus and norovirus from some of the more serious causes, some of the more common causes? Rotavirus is very serious. You're looking at a week-long diarrhea and 2 to 3 days with norovirus. Okay, so first up is mumps. It's caused by a virus. It's the mumps virus. The most common symptom is going to be painful swelling of the parotid salivary glands. The parotid salivary gland is kind of right in front of your ear. Other symptoms, fever. In men, sometimes you get sterility because of inflammation of the testes. In rare cases, you can also get meningitis, which is inflammation of the coverings of the brain, and also pancreatitis. So there are some serious complications associated with this viral infection, which is why it is included as part of the MMR vaccine. Transmission. So how do you get the mumps? It's present in the saliva and also just breathing, sneezing, respiratory secretions contain infectious viral particles. The mumps is very infectious because you can start shedding virus up to 2 days before you start showing any symptoms associated with the infection. Good news is there is a live vaccine using attenuated or weakened virus, and that's the MMR. So there we go. These are just some images showing mumps. Oh, I should mention, so there have been some reported outbreaks recently of mumps. I think a few years ago it was major NHL teams or hockey teams had mumps going around. Like any other vaccine, your immunity is really good and at high levels up to 10 years after you receive this vaccine. And in certain individuals, over the course of time, decades may have passed from when you receive the vaccine to when you're exposed. It is possible that the levels of antibodies you would have against this virus would drop low enough where you would no longer be protected. So it is possible to have received the MMR vaccine, but still, much later in life, if you, in your 30s or whatever, contract mumps, even though you received the vaccine, because you're one of the unlucky individuals who did not maintain high levels of immunity. Just FYI. Okay. All right, so next up is hepatitis. Hepatitis is a general term for inflammation of the liver, and there are lots of different things that can cause liver inflammation, drugs, certain chemicals you ingest, the Epstein-Barr virus, cytomegalovirus, and hepatitis viruses. We're going to be focusing primarily on these hepatitis viruses because they are kind of unique, and we'll talk about the different causes there. All right. So there are actually 5 hepatitis viruses, A, B, C, D, and E, and we will only be talking about A, B, and C today. Transmission. So if you think about the letter A, so A and E actually are transmitted through the fecal-oral route. So usually it's from drinking water that has been contaminated with fecal matter. from someone who's infected. Hepatitis B, C, and D, so kind of the middle of the hepatitis sandwich, if you will, are parenteral transmissions. So parenteral means basically it has to be direct blood contact or transfusion. Hepatitis B can also be transmitted sexually. So these are going to be less commonly transmitted in the general population, where there are certain areas of the world where hepatitis A is going to be much more prevalent. The good news is, even though hepatitis A tends to cause more outbreaks, it tends not to cause chronic liver disease. So this is not going to be something that's going to last years. It's going to be an acute infection that your body's going to be able to clear. However, because it can cause pretty serious liver damage, there is a vaccine available for hepatitis A, and that would be given to you if you were traveling to an area that had endemic hepatitis A transmission. So traveling to Central South America, India, certain East Asia, South Pacific, traveling to those places, you would want to get the hepatitis A vaccine. Hepatitis B can cause very serious chronic liver disease, the most common one being liver cancer. There is a vaccine available for hepatitis B, and actually that is the first vaccine they give to babies as they're born in the hospital. So 1 day, 2-day-old babies receive the hepatitis B vaccine in the hospital, and the idea there is it is possible to get hepatitis B from the mother shortly after or during birth, and giving the vaccine as soon as possible reduces the risk of transmission. And the reason why it's important to catch it early, it turns out with hepatitis B, the earlier in life that you are infected with the virus, the greater the chances are of you developing liver cancer. So that's why it's important to vaccinate young early. Hepatitis C can also cause liver cancer, but there is no vaccine associated with it. Okay, so this just has for you in text what the other slide was in a table. So hepatitis A, fecal oral. If you get an infection with hepatitis A, how would you know? What are the symptoms? So nausea, diarrhea, basically gastroenteritis symptoms, but you also are going to have jaundice often associated with that. So that's a yellowing of the skin and the eyes. Can occur 2 to 6 weeks after exposure. So it is possible for someone to go to vacation, to Mexico or something for spring break, and then you actually wouldn't get symptoms of the illness till after you had been back in the U.S. for several weeks. So again, if you are traveling to an endemic area, you should ask your general care practitioner about receiving the vaccine. Hepatitis C is similar to hepatitis B, but it's more likely to progress to liver cancer, and so hepatitis B information is on this slide. So the most likely methods of exposure are going to be blood transfusions or blood exposure. So again, think about at or around birth. Also, people at risk are intravenous drug users. It used to be people who were exposed to a lot of transfusions, but now blood is screened for hepatitis B, so that risk is reduced. Acute hepatitis B could result in massive liver failure, and chronic infections with hepatitis B can cause these conditions, liver cancer. So again, hepatitis C also shares these features. The difference is it's more likely to progress to liver cancer, and hepatitis B may also be transmitted through sexual contact. Okay, this is just showing you the general structure of hepatitis B, but I wouldn't focus on this. So let me just pen. So, yep, I wouldn't really focus on this slide, really, at all. But it's true. Okay, so because hepatitis B and C are transmitted through contaminated blood products, when scientists and clinicians became aware of this, it raised the importance of having blood banks and donated blood screened for these conditions. So the conditions that are regularly screened for now. We have hepatitis C, HIV, and also West Nile virus. So these diseases are no longer actively transmitted, or you cannot get them from blood transfusions because the blood is screened, and nucleic acid testing is going to be looking for the DNA from those viruses. As an additional precautionary measure, there's a virus inactivation additive that is also added to blood products to further reduce the risk of viral transmission from donated blood products. Okay. All right, so leaving hepatitis behind, we have norovirus. Norovirus, you get this from, again, fecal-oral transmission, so contaminated food, water. You can also accidentally inhale someone's vomit and contract it that way. Norovirus outbreaks, I think most recently I heard of, I believe it was Chipotle had one. So again, that comes from someone had norovirus, wasn't properly washing their hands after they go to the bathroom and then preparing the food, so it's possible to spread it that way. Symptoms: vomiting and diarrhea lasting for 2 to 3 days, and it can occur, half a day to 2 days after you're exposed. Treatment is going to be oral rehydration, and cruise ships often, I think it was last year, maybe 2 years ago, you heard about norovirus outbreaks occurring on cruise ships, and the problem there is if you get norovirus in a cruise ship environment, it's very hard to effectively cleanse all of the surfaces that have been exposed, so you get rapid spreading of the disease in a small confined area, and it makes it rather unpleasant. Okay, fungal diseases affecting the digestive system, there's really only one, and I wouldn't worry about this too much. So, aflatoxin poisoning, so there is a fungus, Aspergillus flavus, that produces a toxin called aflatoxin, and this toxin can damage your liver, and we also talked about Aspergillus, a different strain that can cause lung infections. So ingesting enough of this toxin in your food can cause liver damage. Luckily, it's a rare condition and usually self-limiting. All right. Protozoan diseases of the digestive system. We have Giardia, cryptosporidosis, and amoebic dysentery. Always a fun one. So giardiasis is a fun type of diarrhea caused by the protozoan Giardia lamblia. This guy has flagella, so you can see the flagella here in the image. So this guy is our parasite, and he kind of looks like a little horseshoe crab almost. And then he's got flagella trailing off the end. If you were to turn him over and look at the underside, it's not horseshoe crab legs, but it's a suction cup. And you can actually see here in the image a little mark left by the suction cup as he turns over. He uses this suction cup to firmly attach to the intestinal wall and can cause kind of a chronic mild diarrhea. So flatulence, and kind of a unique feature of this condition is that the flatulence has a rotten egg smell. Not that it ever smells really good, but hydrogen sulfide is a chemical that's produced by the parasite, and hydrogen peroxide is what is associated with that rotten egg smell. So toots, and they smell like rotten eggs, in addition to abdominal cramps. You get this from drinking contaminated water. Dogs can also get this. So if you're drinking stream water, you got to make sure to either boil it or properly, clean it or filter it so that you don't risk contracting this disease. Diagnosis can be string tests, which is kind of interesting. So just to talk about that a little bit. So you have this string in a capsule with a little bit of it leading out. And so what you do is you eat or swallow this pill. The stomach acid will dissolve the capsule and the string will extend through your intestines. And you tape a little bit to the outside of your mouth. And then after 24 hours, they remove the string, and if you do have these parasites, some of them will have detached from the intestinal wall and latched onto the string. So if you look at it under a microscope, you'd be able to see the parasites. It's kind of a cool idea. So treatments, if you do have Giardia, don't worry, they respond very readily to antiparasitic drugs. Antibiotics are for bacteria. Antiparasitic drugs would be for protozoan. Our second protozoal infection is cryptosporidosis, which is caused by Cryptosporidium. It causes a cholera-like diarrhea. It can last for several days, and cholera-like not in its frequency, but in its appearance. So you're not losing 20 liters of fluid a day like you would be with cholera, but it has that water, rice, stool appearance when you do go. Again, you get it from contaminated drinking water, and treatment is going to be oral rehydration. So your immune system over the course of these 2 weeks is going to activate and help to clear the infection without the use of antiparasitic drugs. All right. We find Cryptosporidium cases increasing with the amount of immunocompromised patients we have. So as the number of AIDS and HIV cases increase, we find an increase in the Cryptosporidium cases, and this kind of makes sense if you think about if you have a really robust immune system, your chances of contracting this are reduced. However, if you have a poor functioning immune system like you do when you have AIDS, you're more likely to develop symptoms. All right, our last protozoan is going to be Entamoeba histolytica, and this guy is the primary cause of amoebic dysentery. So Entamoeba, amoebic dysentery, those two words are kind of similar. That's hopefully will help. This amoeba feeds on the tissue lining your GI tract. He's an amoeba. He's normally found kind of free-floating in water, and when they're in that water environment, they go around eating bacteria and other parasites that they find. So when they find themselves in your digestive tract, they have that same ravenous behavior, but instead of eating kind of free-living things, they start munching on your tissue. So because they damage the intestinal lining or the mucosa of the stomach, they're going to cause a bloody dysentery. So blood and mucus very common in the fecal matter of someone with amoebic dysentery. If you were to look at a fecal smear of someone with amoebic dysentery, you wouldn't see, you would see some bacteria because there's bacteria normally in the digestive tract, but you wouldn't see like the pathogenic E. coli or something, but what you would see are the amoeba with, sometimes they have red blood cells present in their cytoplasm, having just ingested them. So these guys, looking at a fecal smear, seeing the presence of these giant nucleated cells, sometimes with red blood cells within them, is kind of a hallmark of amoebic dysentery. All right, so last up are parasitic worm diseases of the digestive tract. We'll talk about tapeworms, pinworms, hookworms, and a couple others. All right. So parasitic worm diseases are very prevalent outside of the U.S. We still have the most common one in the U.S., Ascaris. We also have some hookworms as well. Oh, and pinworms, we also have some cases, mostly in children, but we'll talk about them, all right? So first up are tapeworms. So depending on what you ate that was contaminated, you can actually get a different species of tapeworm infection. So if you ate undercooked beef, you could get the beef tapeworm, Taenia saginchata. Taenia, if you guys remember this term, was also used when we talked about ringworm. So a taenia is actually talking about a worm. So these guys are appropriately named guys. There's another type of tapeworm you can get specifically from eating pork, Taenia solium. Both of these guys are flatworms, and so they look like pieces of tape. That's where they get the nickname tapeworm. With most of these parasitic worm infections, you'll see the symptoms are going to be almost nothing. The reason for this is that the worms are not eating you, they're eating the food that that is in your digestive tract. So if you feel normal, you'll be consuming lots of food, which is better for the tapeworm. If you feel sick, you're going to eat less, and that's worse. So these guys tend not to really cause any symptoms. And actually, back in the day, tapeworms used to be prescribed as weight loss supplements because they would eat enough of the food in the digestive tract, and so you wouldn't absorb a lot of those calories because the tapeworm would be eating them. However, they're not currently prescribed because every once in a while, these guys are living in your digestive tract and they're producing tons of eggs. So every once in a while, it is possible to have the eggs leave the digestive tract and enter into the circulation and then end up in places they're not supposed to, like your brain and your eye. So again, when that happens, that's not good. So because of the risk of that occurring, we no longer prescribe tapeworms as weight loss supplements. But basically the worms continuously shed eggs. And every once in a while you can get one of the worms that leaves the digestive tract through the anus, and it can be up to 1.2 meters long. And they can grow as soon as 8 days after you're inoculated or infected. So it's kind of cool. So this is how you get tapeworm infections. So depending on the undercooked meat, either cow or pig. So the same thing is happening in the cows and pigs, where the adult worms live in the digestive tract, but they lay eggs, and the eggs can penetrate the intestinal wall and circulate and land in the muscle. And in the muscle, we have a little cyst that develops, and in the center of the cyst is kind of like the egg pouch, you can kind of imagine it as, of the tapeworm. So we eat the muscles from the animals, and if they're undercooked or if they're raw, this cyst or oncosphere would be viable. So as you eat this raw meat or undercooked meat, and it gets into your digestive tract, then the egg kind of hatches and the adult tapeworm can form. The tapeworms are flat, and actually if you look at one of the little segments of the tapeworm, it has, can produce thousands of eggs. It's crazy. All right. So this is just another image of the tapeworm showing you the flattened body. The head of the tapeworm is called the scolex, and that's going to look a little bit different depending on the type of tapeworm you're infected with. And again, just looking at one of these little segments, a single segment, we have ovaries and testes, so they can kind of self-fertilize and just release thousands and thousands of eggs. Amazing. Oh, and this is, again, why? Well, why not tapeworms for weight loss? Is because an egg can end up in your eye, and then it's hatching. You see the little head of the tapeworm here, and the rest of the body is kind of back inside this little cyst. Dogs also get tapeworms. The dog tapeworm is called Echinococcus granulosus. And there's a minimal risk of you contracting tapeworm from your dog, but the problem is it's kind of the same phenomena where even though your body will clear the adult infection, it's possible to have an egg escape and then land in a place where it doesn't belong, like your brain. And when the egg embeds in the nervous tissue, your body tries to wall it off and forms a cyst. So in this case, it's called very specifically a hydatid cyst that develops from dog tapeworms. So just make sure you wash your hands, because this is, again, this tapeworm would be transmitted through the fecal-oral route. So anytime you pick up dog poop, you should wash your hands. And I shouldn't have to tell you that, because you should know. This is just showing you how people can become infected. Wild animals as well as domesticated dogs can also have it. This is just a table comparing and contrasting the two types of worms we discussed, the tapeworm and the Echinococcus. Ooh, pinworms. All right, so pinworms is the common name. The scientific name of the worm is Enterbius vermicularis, and he's a nematode, so he looks more like a round worm than a flatworm, so each of these are an adult pinworm. The adult worm lives in the large intestine, which is the last end or tail end of your digestive tract. And at night, they come out of the anus, and the mature female lays eggs around the anus on the skin. and basically it also creates a lot of itching. And so what happens is the child's butt becomes itchy, so they scratch it with their hands, and then they eat things with their hands, so they're self-inoculating those eggs. You can also get it from if the child slept in bed and you guys shared sheets or something like that, or clothing that hasn't been appropriately washed or disinfected. You can get it that way. So in daycare settings, you can get pinworm kind of outbreaks. A fun test to look for tapeworms is tape over the anus. So a little piece of tape over the anus at night, and then the next day you would take the piece of tape off and put it under a microscope, and you are going to be looking for the presence of the eggs on the tape. This is just showing you a pinworm under a microscope. Where does it live? They kind of live all throughout your intestines, but mostly at the tail end, with the mature females coming out at night to lay eggs. All right. Really, the only symptom is going to be this itching around the anus. Other than that, they're not going to cause really any GI symptoms, and they can be easily treated with an anti-worm medication. Hookworms. Hookworms is the common name. The scientific name is Necator americanus. They are found in the southern United States, and they're going to attach with little hooks, I'll show you in a second, to the intestinal wall, and they can also use those hooks to bore through the skin. So this would be an example of a digestive tract infection that isn't necessarily fecal oral contamination. So what happens is you walk over some soil that has the hookworms present with bare feet. The hookworms bore through your skin, and then they make their way from the circulation into your lungs, and then you cough them up, swallow them, and then they get into the digestive tract, then they get pooped out, and the cycle starts over again. It is possible to have slight anemia with a hookworm infection, and if you look, this is the mouth of the hookworm. It's actually grabbing onto the intestinal wall and kind of sucking your blood out of you, so that would be the blood loss there. It's like a little vampire. Okay. Our last parasitic worm infection, Ascariasis lumbridosis. This one is common in the southeastern U.S. It's the most common parasitic worm infection in the U.S. This guy is a nematode, so again, he kind of looks like an earthworm. He's round. Symptoms, thank goodness, are usually few. Sometimes they'll be present in your lungs, so you can get some respiratory or breathing issues. However, so even though normally they're not going to cause a lot of symptoms, it is possible to get such a large burden of the worms in your digestive tract that they come out kind of en masse, which can be rather traumatic, I would guess. The eggs are shed in the fecal matter, and then you're ingesting them. Usually areas with poor sanitation, you're going to have the presence of these. So thank goodness in where we live, we have very good sanitation, so we don't really see hardly any of these human parasitic worm infections. Usually, because they're asymptomatic, they're only diagnosed when the adults leave the body, and they can leave any orifice. Most commonly, it is going to be the anus, mouth, nose. Every once in a while, belly button. That's kind of rare, though. Oh, goodness, trichinella. Trichinella is pork tapeworms, or it's not a tapeworm, but it's a pork parasitic worm infection. So if eating undercooked pork puts you at risk for trichinella, and you can also get tapeworm from the undercooked pork, right? So there's two things. Normally found in pigs. It is possible to get some symptoms with this, fever, swelling around the eyes, some GI upset, but again, usually asymptomatic, but in a few people may experience those symptoms. So don't eat undercooked pork. All right, life cycle of trichinella. Again, humans get it from eating undercooked pork products, and animals get it from exposure to other animal products. Here's a table comparing the three parasitic worm infections we discussed last: hookworms, ascariasis, and trichinella. And again, even though these guys are big, we talk about them in microbiology because you use a microscope to diagnose them, right? So you're looking usually in the fecal matter for the presence of those eggs, and that is how they're diagnosed, and that's why we talk about them in microbiology. Luckily for all of these, there's a very effective anti-worm medication that's effective at eliminating these. And that's it. So any questions, please feel free to email me, and there will be a quiz due before class on Tuesday that covers the digestive system. So I will see you in class Tuesday. All right, let me just turn this.